Hello, my name is Johnston Thayer, and I'm here with Terralyn Stevens and Jeffrey Morelli, and we'll be speaking to you today on the ONC Interoperability Rule and the market impact that we anticipate this change will have. So to begin with, we'll start with a market overview. So we're talking about the health technology and digital solutions market. And this market is currently controlled by two primary stakeholders. One is the health systems who actually capture all of the data as they're working with patients and providing care, and then they are storing all of that data using electronic health records. And because any digital or technology solution requires data inputs in order to power the actual technology, this gives a great deal of market power to these two groups. And so today they are the primary stakeholders of the market in general. Now, there has been some criticism in the past around interoperability between both the health systems and the EHRs. Traditionally, interoperability or the sharing of data is thought of being between one health system and another. This is true, but it is also, and in this case, more focused on one health system to another health technology, including things like applications on a smartphone. And at first, it may seem like this is a pretty straightforward solution if you think about something like blood pressure. If you need to send a blood pressure value to another solution, it should be just as simple as moving that value from one health system or technology to the other. But if you consider how this can get complicated, think about if one health system is storing those blood pressure values in two different data elements. So the systolic and diastolic are stored separately. Well, now if you try to send that information, when it reaches that second system, you lose one of the values and the remaining value is actually incorrect and not meaningful to a patient. And so this can result in bad data and poor performance, and possibly worse if you're getting incorrect values for patient reading. Now, this is not just one value, though. There are many thousands of different types of data elements that a health system shares, and it's not just one other downstream system. It's a whole network of other different types of healthcare systems and applications that need to receive this information. And so it's a complicated problem. To help solve this problem, the ONC, or the Office of the National Coordinator, has proposed to begin using APIs, or application programming interfaces. And essentially, you can think of this as taking in those various forms of how data might be stored in one system, formatting that information to a mapped standard so that it's put out to the other system in the way that would be expected. And so this can help with those wide networks of sharing information to make sure that everyone is getting the information in the format that they would expect. And so again, there has been new legislation that was actually just finalized a couple of days ago. It's over 1,200 pages, so quite a long report. But the two main components of that report that we'll be focusing on today is that EHRs must create standard APIs for many new data elements that allow them to share more information with other applications. And another significant change is that the EHRs and health systems no longer decide who gets to receive that information. That is now controlled by the patient. And so giving access to the consumer means that there will be a distribution of market power beyond the two stakeholders that exist today.
Thanks, Johnson. The ONC rule for interoperability in healthcare will impact the innovation framework. Innovation in general is a key component to differentiate businesses in the marketplace and maintain competitiveness through market power. Product innovations introduce new products and services. Process innovations enhance internal production processes. Currently, the main IT system in healthcare is EHR. That houses all patient data on medical care, diagnosis, and treatment. EHR vendors have tremendous market power with only a few dominating 70% of the market share. The ONC rule will change that framework of innovation, allowing for smaller and more agile healthcare tech companies to bring products to market. This was previously a challenge due to the EHR vendors acting as information gatekeepers. Large EHR vendors that previously held substantial market power will be faced with increased competition from solutions that have greater access to medical record data, shifting the market structure. Next. There will also be a major shift in complementary innovations such as IoT, or Internet of Things. These devices connect through Wi-Fi or Bluetooth Low Energy to stream raw event data from their point of capture, with examples such as glucose monitors, blood pressure cuffs, or telemetry devices. A streamlined patient data landscape allows for these types of IoT innovations to easily integrate with the EHR data source, providing ancillary data and improving the overall standard of care. In addition, Interoperability enables a core foundation of data to be leveraged for artificial intelligence and machine learning. This allows for predictive and preventative analytics for next best action recommendations or decision support for providers. Next. Another framework that will be disrupted is the quality of care framework with shifting care models. Physicians will have access to more patient data with higher quality, better communication pathways with prior physicians treating the same patients, and more information, allowing for better informed decisions about treatment. If complete data sets are available to providers for past medical history and visits, the level of efficiency can be increased. For example, patients with IoT care devices such as a heart monitor or insulin measurement devices for diabetes can have their measurements streamed to a cloud database in real time and posted to his or her electronic medical record. Anomalies can be detected based on trends and alert a physician immediately in the case of an adverse event. If the patient goes to see a family physician at one healthcare system and then a specialist at a different hospital, all that data is available for the same patient, reducing the cost of needing to reorder tests that could have already been performed. With increasing competition in the marketplace, consumers have a greater choice in which providers to visit for treatment when innovation, quality, and efficiency of care are acting as a differentiator. Now I'll turn it over to Carolyn.
Thanks, Jeff. So we know that the healthcare industry data market is generally controlled by three large EHR vendors, Epic, Cerner, and Meditech. These vendors control 70% of the market, as Jeff mentioned. We know that these market leaders would not be in favor of such a rule, as it would allow for smaller and newer vendors to enter the market, creating more competition and reducing market concentration. The healthcare data market is expected to grow at a compound annual growth rate of 13% over the next forecast period, and this is driven by the need to cut healthcare costs and enhance patient care. The rising cost of healthcare creates demand for data interoperability, and the proposed rule would lower the barriers of entry into the market. This would also create paths for innovation for the big players to further differentiate themselves within the market. Mobilizing healthcare data and enabling info exchange across the spectrum of providers to create the ability for patients to patients to better manage their health will propel the industry growth. Next. The interoperability solutions market is divided into software solutions and services, with services accounting for the larger market share. Due to the need for more access to patient data and IT solutions to enhance quality of care, the health information exchange is expected to grow at a higher rate. Currently, public hospitals and multiple specialty departments have higher adoptions of EHR. End users such as diagnoses segments and hospitals have a larger market share, which is driven by increased demands for data exchange and flow of information for treatment and diagnoses. Data exchange is expected to make the diagnoses and treatment process easier, safer, and higher quality. Predictors of market change can be analyzed through metrics such as health outcomes, diagnoses, and treatment cost. Providers have reported that EHR allows them to deliver better care by reducing errors, improving quality of services, and providing optimal bundled care, while patients also report better satisfaction. Next. The ONC proposed rule is an attempt to improve quality of care, and opening or expanding the healthcare technology market is an innovative way to do so. We know that there is opposition to such a change, so we have a few recommendations. In order for patients to be able to make informed decisions about their health data and how it's shared, apps who request info from EHR vendors should be required to disclose which data will be requested. Additionally, we recommend limiting the scope of data needed to exchange to that which is most important for use by tech vendors. This will help improve the quality of information made available and limit concern of bringing this type of change to the market. Lastly, to address patient privacy concerns, selling healthcare information should be legally prohibited. These recommendations can surely improve and enhance the outcomes intended by this proposed change in legislation. Thank you for joining us.